Welcome everyone. In today's video, we are going to talk about the Lauge-Hansen classification for ankle fractures. Now this is a very important classification which can be confusing at times. So let us try to simplify this classification. So Lauge-Hansen classification describes ankle fractures in three parts. The first two parts are words and the third part is a number. So let us see the words. The first word is the position of the foot at the time of injury, which can be supination or pronation. So the first part of the description of the fracture contains either supination or pronation. The second word is the deforming force at the ankle at the time of injury. So we have three deforming forces. The first is external rotation, which may be present with both supination and pronation. And we have adduction, which is present with supination, and abduction, which may be present with pronation. So a way to remember is, if you look at the diagram, the foot is deviated medially in supination. So with supination, we can have adduction, whereas in pronation, the foot is deviated laterally. So with pronation, we can have abduction. Now, based on these two parts, we may have four classes of injury, that is supination-external rotation, supination-adduction, pronation-external rotation, and pronation-abduction. Out of these, the supination-external rotation is the most common with 60%, whereas supination-adduction is present in 20% of the cases, pronation-external rotation in 12% of the cases, and pronation-abduction in around 8% of the cases. The third part of the description is a number, which is either 1, 2, 3 or 4, which denotes the stage of the fracture. So supination-external rotation has 4 stages, supination-adduction has 2 stages, pronation-external rotation has 4 stages, and pronation-abduction has 3 stages. So we saw that there are 3 parts. First is the position of the foot at the time of injury, second is the deforming force, and third is the stage of the injury. Now coming to the supination-external rotation fracture. So in supination, we have to remember, if you see the diagram, the lateral structures are under tension and the medial structures are relaxed. So in any supination injury, the injury will start from the lateral side, whereas in a pronation injury, it will start from the medial side. The first stage is the supination-external rotation 1, in which talus rotates inside the mortise, pushing the tibia and fibula apart, leading to an injury of the AITFL or the anterior inferior tibiofibular ligament, causing a stable ankle sprain. As the injury progresses, in the second stage, the fibula fractures at the level of the syndesmosis, and this has a classical long posterior spike. So the spike in this type of fracture is a long posterior spike with a minimal displacement, and this also represents a stable ankle injury, and the treatment is usually non-operative treatment. Coming to the third stage, there is a posterior tibiofibular ligament rupture or a posterior malleolus fracture. So as the external rotation progresses, it goes posteriorly and there is either a posterior tibiofibular ligament rupture or a posterior malleolus fracture. And in the fourth stage, the medial ankle or medial aspect of the ankle is injured, which may involve a deltoid rupture or an oblique fracture of the medial malleolus, making the ankle unstable. So the ankle becomes unstable, and this stage requires an operative management. So what do we do in the operative management? In the lateral side, we will either put a lag screw with a neutralization plate or an intramedullary stabilization. In the medial side, we put orthogonal lag screws. And syndesmosis is assessed and is stabilized if the syndesmosis is found to be unstable. Coming to the next type, which is supination-adduction. Again, it is supination, so the injury will start from the lateral side. So the adduction of the hindfoot will cause a talofibular ligament rupture or a transverse avulsion fracture of the fibula. So either a talofibular ligament rupture or a fibular fracture. This is again a stable injury. In the next stage, we have a shearing of the medial malleolus leading to a diagnostic vertical fracture. So if we see a vertical fracture of the medial malleolus, it is almost diagnostic of a supination-adduction injury. There may be an impaction fracture of the medial plafond, and this type of injury, that is the SAD2 injuries, are unstable injuries. Now the treatment of this injury is different from other types of ankle fracture because the fixation starts from the medial side. So first we have to remove these osteochondral fragments. If any loose fragments are present, then we reduce the intraarticular part, do bone grafting for the void, and then fix the medial malleolus with a buttress plate. So in a supination-adduction injury, medial malleolus is better fixed with a buttress plate to prevent gliding of the medial malleolus superiorly. The fibula can be managed with a plate, nail, or tension band wiring. The next type is the pronation-external rotation. Now we saw in pronation, the medial structures are taut and the lateral structures are relaxed so that the injury will start from the medial side. So in the first stage of the pronation-external rotation, there is a isolated medial malleolus fracture or a deltoid rupture. In the second stage, there may be a rupture of the AITFL or a caput tubercle fracture. In the third stage, we get a spiral or oblique fracture of the fibula, which is classically a suprasyndesmotic fracture. So it is mostly a high fibular fracture, and this is an unstable form of ankle injury and has a high incidence of association with a syndesmotic injury. A classic pattern is known as Maisonneuve fracture. So what is this Maisonneuve fracture? This is again very important. So this is a fracture in the proximal part of fibula, which is associated with a medial malleolus fracture or a deltoid ligament rupture. Now this is often missed. So you have to palpate the proximal part of fibula whenever you suspect a deltoid rupture or see a medial malleolus fracture. Now coming to the treatment of this type, if the fracture is in the lower 1/3 of fibula, it is fixed with a plate along with a syndesmotic screw for the syndesmosis. If the fibular fracture is proximal to the lower 1/3, then only syndesmotic fixation is done and medial malleolus is fixed with orthogonal lag screws. The fourth type is a type 3 with either a posterior malleolus fracture or a posterior tibiofibular ligament injury. Coming to the fourth type or the pronation-abduction fracture. Here, as the talus abducts, this leads to a transverse fracture of the medial malleolus or a deltoid ligament rupture. Again, pronation injury, it starts from the medial side. In the stage 2, now the fibula is pushed laterally. This leads to a AITFL injury or a avulsion of the caput tubercle, as we saw in the previous type also. In the third type, the fibula fractures due to compression and bending force, and the classic pattern of fracture is a comminuted fibula fracture which is at or above the level of the plafond. Now, the unique thing about this fibula fracture, which is PAB3, is that we have to do a bridge plating because there are comminuted fragments. So we have to do a bridge plating. And medial malleolus can again be fixed with a lag screw or a tension band wiring. This is followed by assessment of the syndesmosis and fixation if required. Now let us have a look at the advantages and limitation of the Lauge-Hansen classification system. So the first advantage is it guides in the treatment, as we saw in the classification. Through the stages, we get an idea what kind of fixation has to be performed, and this has a prognostic value because a higher stage has seen to be positively correlated with the articular damage that occurs in these fractures. The limitation is more to do with the inter-observer reliability and reproducibility. So there is only moderate to poor inter-observer reliability. Syndesmotic injury is not reliably predicted by this classification, and some cases do not fit any injury pattern according to this classification system. So friends, in today's video, we discussed the Lauge-Hansen classification of ankle fractures. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.